My son Jonathan, as an infant, had an ingrown toenail, and it was very infected. It was very swollen, and it was bleeding, and he was in a lot of pain and discomfort from it, and we really needed to do something about it really quickly because we knew that he was having a lot of pain from it.
I needed pliers to cut my toenail. It was so hard and rough and disfigured. Even when I put nail polish on it, it looked different than the other toenails. My father's condition was so severe that I really was scared that I was going to have that. He always had blisters and sores on his bottom of his soles of his feet, and so I was really nervous that I could end up like that if I didn't treat it.
I have a toenail that seems to grow down into my foot as opposed to growing out. And every 3 weeks I'd have to peel the nail because it was so painful. It was digging into my skin going in.
Onychomycosis, or more commonly known as fungal toenails. It's a problem that is affecting millions and millions of Americans and millions of people worldwide. So it's an infection, actual medical condition that affects hair and nails, but the one we're talking about affects nails of the hands and feet. It's a very, very ubiquitous organism, and it can be picked up anywhere. It can be picked up in your school, in your own shower, the pool, your gym, clubs. And once it's in the nail, it causes a tremendous amount of embarrassment for patients because it changes the color of the nail, it changes the consistency and the thickness of the nail.
It had been a source of pain and embarrassment for him because of the location being on his toe, and he's an active child running around a lot. There would be times when he would hit his foot or something, and that nail would cause him a lot of pain because it was always very tender.
It was just something that people knew about me, and I would mention it if I was wearing a pair of sandals, and I would say, isn't this an amazing fake toenail? I would say, look at my nail, you can't even tell that there's a problem here. But it hurt after a while because the nail would grow underneath the fake nail, so I'd have to take it off every 3 weeks because the nail would grow so far deep and it was pressure under the shoe and it would hurt.
I've always been a little embarrassed in the summertime especially because my nail was always yellow and kind of deformed looking. So I wanted to look into some options, to take care of that and rid that.
For years and years, the only treatments have been topical medications, which really the efficacy or the ability to treat the problem has been very, very limited. Later on, we did develop medications that could be taken orally that could help eradicate the problem, and they were the most effective at the time, upwards of 50 to 70%. But the problem was we were limited to the population we could treat with the medication. We could only treat patients who were in good health, who were not allergic to the medication. We absolutely could not treat children with this medication. So we were basically ignoring a whole population that was affected with this problem.
I took Lamisil, I took it orally, not topically, and 3 weeks to the day I rushed myself to the hospital. I had a very bad allergic reaction, and it took about 6 months to get out of my system.
At his age, being 1 year old, between the ages of 1 and 5, he was certainly not a candidate for any kind of oral medication to treat toe fungus.
I didn't want to take any medication like that.
In the last 10 years, I would say this is the most exciting thing that has come into my practice. The ability to use a laser that has a track record of safety to eradicate a problem that is throughout the entire population, and I can use it from small children. I've used it on children as young as 4 years old, and I've used it on 80-year-old women who are on hosts of medications who couldn't add another medication to their regimen. And I can get cure rates upwards of 88% of the time. So this is really just an evolution of technology, which is really creating a revolution in the treatment of fungal toenails. The procedure is not only not painful, oftentimes it's very, very comfortable. I'm able to have a conversation with them throughout the procedure. Some of my patients bring a book or they bring some work with them. Some of them even listen to their iPod while I'm treating them.
If it took more than 10 minutes, it was a lot. And it was not painful at all. It was a little hot, but nothing that you couldn't, I need a shot. Like I need a shot at the dentist when I go have my teeth cleaned. That's how sensitive I am, and it was fine.
He thought it was just the coolest thing to see a laser that he sees in cartoons and movies, and he thought it was just the greatest thing ever to have the treatment. There was no pain whatsoever. And he didn't even realize that a procedure had even occurred, you know, in my perception, because he had no reaction whatsoever. He was more impressed by the cool laser.
When the procedure was being done, I didn't feel any pain. I felt no impingements on anything. All I felt was a little bit of heat and this cool breeze being pushed into my foot about every 30 seconds, but I felt no pain at all while he was doing the procedure. It was great.
There's absolutely no downtime at all. There's no need to cancel plans for that evening, and there's no reason to take a break over the weekend. You return directly and immediately to your preoperative status.
I just put my shoes on and I went home. Didn't feel it, didn't have to ice my foot, didn't have to put it up. Went home, put the topical polish on it, and put my shoes back on. It was nothing.
Not shortly after, immediately after, you know, as soon as he walked out the door. There was no post-procedure pain or discomfort or anything of that nature. It was as if nothing had ever happened.
They're not just coming in here and being treated in a factory-type setting. Here they're getting a full examination, and when they leave here, they will have information about their foot health. They will also get information about curing their fungal infection, and they'll feel that they're in a place is a safe, clean environment. Having everything in my office, every instrument that ever touches a patient is completely sterile. I mean, after all, what is the point of coming to an office, getting clean of a horrible fungal infection, and then using a dirty instrument on them? The feedback that I'm getting after this procedure has been nothing but positive. I've treated patients with severe fungal infections with this laser. Patients who have had fungal infections for most of their adult lives, who have tried everything. They have tried every home remedy, every remedy in the stores with absolutely no relief. And after one session with the laser, they're feeling better, their nails are looking better, and they are absolutely thrilled with the result. I couldn't be happier with what I'm seeing with the use of the laser.
After Jonathan realized that the laser treatment was working and he noticed a new nail growing in that was white instead of black, he couldn't stop telling us, you know, he couldn't stop showing us how look, it's growing in, it's okay, it's a good nail, it's growing in.
I have told the people that I've worked with, because it's very, you know, cosmetically it's important, I guess. You know, especially with the summertime coming, and, you know, you want to look good and wear sandals. And
Everybody on the planet's gonna know that I don't have an ugly toe anymore.
I would absolutely recommend it, and I have recommended it to people who have, you know, have similar problems.